Can PTSD affect blood pressure or heart rate? Can post-traumatic stress disorder affect blood pressure or heart rate? The answer is yes. Post-traumatic stress disorder, often abbreviated as PTSD, can indeed influence both blood pressure and heart rate. This condition is marked by hyperarousal, which is a state of heightened physiological and psychological tension. When someone experiences hyperarousal, their sympathetic nervous system becomes more active. This is the part of the nervous system that triggers the fight or flight response. As a result, individuals with PTSD may experience elevated heart rates and increased blood pressure. Research supports this connection. Studies have shown that people with PTSD often have significantly higher systolic and diastolic blood pressure compared to those without the disorder. For instance, in some veteran populations, individuals with PTSD have an average systolic blood pressure of around 130 for millimeters of mercury, while those without PTSD average about 122 millimeters of mercury. Similarly, the diastolic blood pressure in PTSD patients tends to be around 88 millimeters of mercury, compared to 79 millimeters of mercury in non-PTSD individuals. Heart rates also tend to be higher, with those suffering from PTSD averaging about 79 beats per minute, while non-PTSD patients average around 73 beats per minute. These findings indicate a clear link between PTSD and increased cardiovascular activity. The physical reactions associated with PTSD, such as hypervigilance and an exaggerated startle response, reflected this heightened activity of the autonomic nervous system. Neurobiological changes in PTSD include alterations in the noradrenergic system, which plays a key role in regulating stress responses. This can contribute to the increased heart rate and blood pressure seen in those with PTSD. While some studies have shown variability in blood pressure changes related to PTSD, the overall scientific consensus supports the idea that PTSD symptoms are correlated with elevated blood pressure and an increased risk of hypertension. This is significant because high blood pressure and elevated heart rates are known risk factors for cardiovascular disease. In summary, PTSD can lead to sustained increases in both blood pressure and heart rate due to its effects on the autonomic nervous system and stress response mechanisms. These physical symptoms are part of the diagnostic criteria for PTSD, particularly concerning alterations in arousal and reactivity. It is crucial to recognize and treat PTSD not only for mental health reasons, but also to mitigate associated cardiovascular risks. If you or someone you know is experiencing these symptoms, it is important to seek professional medical evaluation and care to manage both PTSD and its physical health consequences.